Welcome. I'm Dr. Jessica Everett, and I'm the Global Medical Director of Child Family Health International. It's so wonderful to be here today with you and discussing evolving definitions of global health. Just a few housekeeping items. It would be wonderful if you could put your name and where you're coming from, either institution or geographic location in the chat, just so we can see who all is here. We are going to be saving time at the end of the hour for question and answers, and you can use the Q&A function in your Zoom um, bar to ask questions. We will try to send out some helpful information in the chat, but if you want to introduce yourself in the chat, who you are, where you're from, what institution you're with, any other fun facts would be great, and we're going to get started. So as I mentioned, I'm with Child Family Health International, who's sponsoring the webinar, and it's really exciting to bring this to you today. In addition to doing research and webinars, we also run global health experiential programs for undergraduate, graduate, and postgraduate trainees in 10 countries. And our team spans amazing locations where we really focus on the strengths and assets of sustainable health systems and embed learners in culturally diverse settings. So I'm not going to talk much about our program today, but we do want you to learn more about us. You can go to our website, www.cfhi.org. Students can both direct enroll to CFHI, and we partner with universities and colleges to enable global mobility. Lots of alumni and lots of awards, and we're super proud and excited to be doing what we're doing. So we hope you learn more. And while myself and Blair and our executive director, Robin Young, are here today, we are just a couple of people standing on the shoulders of our global team. So I wanted to shout out to them and thank everyone for the privilege of representing this team today in this webinar. I also want to introduce our panelists. I'm so excited and humbled to be in their company. So, Dr. Kathryn Jacobsen is a professor of epidemiology and global health at the University of Richmond. She's also co-founder of the CUGH Gecko, which you're going to learn more about this hour, and is an amazing network. She's an active leader in many things in CUGH and does a gamut of research. Dr. Dele Ogunshetan is here. He is a distinguished professor at UC Irvine, who is actually the founding chair of their Department of Population Health and Disease Prevention. He has led training and empowerment programs for USAID One Health Workforce Next Generation Project across 17 countries in Africa and Southeast Asia. And then we have Dr. John Olepo, who is the Associate Clinical Professor in Global Health at Northeastern University in Boston. He's also the Associate Director of IVAN, the institute in Nigeria that is a leading force in implementation science. And we did a webinar last year on IVAN. So I welcome you to look at our archives and learn more about that amazing network and opportunities to collaborate on implementation science and research with the IVAN Institute. Dr. Abram Wagner is the Assistant Professor of Epidemiology and Global Public Health at the University of Michigan. His research focuses on viral respiratory diseases, and as a mother of three, I'm very grateful for that, and vaccine preventable illness. And last but not least, we have Dr. Carol Waggett, who is a professor and chair of global health studies at Allegheny College. She also has many other titles, but of them includes the director of Teach Global Health, which is in collaboration with the AAC&U, and she's also co-chair and founder of Gecko, which I'm excited that you're going to speak to this hour. So without further ado, I would like to center us on why we're here today, which is that we have often, many universities and practitioners in global health, particularly those situated in the global north, have been using a definition that was published in the Lancet in 2009. This definition actually stemmed from a meeting in 2008 that was convened by the Consortium of Universities for Global Health. And the definition is longer than this, but at the gist of it, it says that global health is an area of study, research, and practice that places a priority of improving health and achieving equity in health for all people worldwide. And so there's been a lot of reflection and controversy around this definition. There was also a definition at the same meeting that was put forth by a Kenyan colleague who said that global health is actually a fabrication of high-income countries to describe what is regular practice in developing nations. And so while we're not going to speak today about the colonial aspects per se, I do want to investigate this new proposed definition of global health, which is that global health is a field of academic study, research, policy, and applied practice that advances the equitable protection and improvement of population and planetary health. Both Kathryn and Carol are co-authors on this paper, and so I want to welcome you to speak to us about this definition. And I want to name that really, I think the spirit of this definition and of the paper that you recently published in October is to invite conversation. And this is the closing sentence of the paper that we hope that this updated definition will enrich conversations about global health scope, relevance, value, and modernize how the field of global health is conceptualized and applied in teaching, research, and policy contexts. So in the spirit of inviting conversation, that's what we're doing today. So welcome, everyone.
So thanks, Jess. I'm going to be talking a bit about how the new definition from CUGH is updating the older definition that's coming up on 20 years old. Global health is a dynamic field, and we are aware that it has become more complicated. So if you look at some of the headlines recently on the next slide, you'll see things that we're all aware of. The withdrawal of the United States from WHO. So our global health governance structures are less robust than they were just a few months ago. We've seen the unexpectedly fast closure of USAID. And so some of the big players in global health don't exist anymore. We've seen significant cuts in funding, not just in the US, but from a lot of other sources. We're also very aware of climate change accelerating and the debates about that, and the US withdrawing from the Paris Agreement. So, global health is to some extent more important than ever, even though it's more complicated. So, when we were a working group tasked by Keith Martin, the executive director of CUGH, our mission was to try to come up with an updated definition that would balance the reality of this complicated time in a complicated field with retaining some sense of idealism about what we aspire for global health to be. So we wanted to retain global health equity as the ultimate goal of global health. And we wanted to frame global health as a big umbrella, but not one that is completely boundaryless. So we developed this 5Ps model, and there are two axes that have the 5Ps on them. So the first one, if we can advance the slide there just to simplify this for our eyes a little bit, is emphasizing on the people-planet axis that the word global has two meanings. So one definition of global is that it's worldwide. And so this axis talks about the planetary side of global health, not just planetary in the sense of climate change, biodiversity loss, One Health, but also planetary in terms of globalization processes, international migration, pandemics, antimicrobial resistance, things that truly do affect every person worldwide. The other meaning of global is comprehensive or holistic. And so the people planet axis also talks about the individual, community, national, and international experiences that affect human health. So the socioeconomic and political drivers of health, the ability of health systems to enable people to access medical care and public health services. The vertical axis then is for priorities at the top and policies and practices at the bottom. And the idea here is that we wanted to emphasize that part of global health is about having discussions and using words and numbers and data to understand how to establish international collaboration, law, human rights, and the evidence, the economic impact, the global burden of disease that shape decision making. But a lot of global health takes place around the world in local communities. And so those global health partnerships that combine the work of government, civil society, the private sector, the interventions, whether it's financing, implementation, evaluation, we are an action-oriented field. And so if we put that all together, our goal, to be clear, was not to limit what is global health. So the examples that are on this chart are illustrations. They're not exhaustive. Individual practitioners, which is almost everybody, I'd assume, who's on this call, we each tend to work in one domain, and that's the domain that feels comfortable for us. If we are just coming up with education systems, we want our curricula to touch on all of these areas so that our students are prepared to understand the full scope of global health. So moving on then to the comparison of the definitions. We took a hint from improvisational comedy. So improv says you always say yes and you don't say no to people. And so in our yes and approach, we ended up making 3 additions to the old definition. So we updated this by adding policy to the definition, by moving from saying the goal is to improve health to saying it's to protect and improve. So there's an and in there. And to move from the focus just on people to saying people, yes, and planetary. So I'm going to very quickly just highlight those 3 yes and additions that we made. The first one was to add in policy. And why are we adding in policy? It's because governance matters. So institutions, instruments, initiatives, this is how global health gets done. And so we wanted to have a definition that acknowledged that governments play a role in global health. A lot of other partner organizations are also involved in that. So when we looked at our definition, going to the next slide in the paper, we said we recognize that for most of us who work in global health, health equity and social justice are driving values. They are motivating ideals. But we also recognize that governments, corporations, some philanthropists invest in global health for strategic and political reasons, not just because of shared values. So our goal for this paper then on the next slide was that our definition had to align with a broad set of motivations, mechanisms, and actors in global health. And adding policy to the definition was a way to recognize the work of governments and other people who are involved in advocacy for policy. The second yes and was to add in protect. And this is partly about saying health security matters. If we're going to be really pessimistic about this, we'd be saying, if we can't improve, at least don't get worse. But protect isn't just about not getting worse. Protection is how we advance human rights. We protect people's human rights. Protection attenuates risk factors. It prevents new public health threats in an equitable and just manner. And then the third yes and is planetary, because our environment matters. It's central to the Sustainable Development Goals. And since the Kaplan definition was published in 2009, we have now come to see that climate change, biodiversity loss, and persistent pollutants, especially plastics, are leading threats to the health and well-being of current generations and future generations. So with that, I'm going to turn this over to Carol to ask her to talk about why planetary health is so central to global health.
Thanks, Kathryn. All right, you can advance to the next slide here. Over the past many decades, we've recognized that there is an expanded scope of global health, right? We've seen this through human disease, the epidemiological transitions. We no longer just talk about injuries, it's injuries and infectious disease, injuries, infectious disease, and chronic health concerns. And in most spaces, it's those all wrapped up together. It doesn't really move from one to another. It's all of them in combination. The nutritional transition is similar. Caloric and nutrient deficiencies perhaps were primal at one point in time, but we have those as well as overconsumption and the consumption of less valuable nutritionally valuable foods as well. We're expanding the scope of social and structural determinants, right? And those have changed, moving from just survival to thriving. We've migrated over the Millennium Development Goals. It expanded from just the 8 goals and predominantly looking at low-income communities to 17 goals that span many more categories and include the work within of advancing health and health equity within all countries in the globe. So we've recognized those, but we haven't addressed the expansion and the scale of environmental health considerations. And I'm going to highlight 3 of these very briefly, just to kind of showcase how significant the scale change is. So on biodiversity loss, keep it on that same slide if you don't mind for just a moment. The icon is what we tend to think of when people think of biodiversity loss, these large charismatic megafauna, right? Very important. But when I think about it, I was trained in vector-borne diseases. I think about the loss of the insect world, right? The recent UN assessment has found that 500,000 insect species are under threat of extinction, and 40% are on decline. We think about insects, the decline of insects, and that's contributing from pesticides and climate change and habitat loss, but they play critical roles in the foundation of the entire food chain and pollination and the breakdown of waste, right? So we tend not to think at the scale at which this impact is having. So biodiversity loss is one major area that has an expanded scale that cannot be addressed in simply looking at a local area. The persistent contaminants, right? These are contaminants that resist degradation. They bioaccumulate and often biomagnify in wildlife and human tissues. They undergo long-range transport and they're toxic, right? Exposures linked to cancers, immune system damage, reproductive, endocrine dysfunction, developmental defects, right? And these are things that are coming from our agricultural systems in the form of pesticides, industrial processes, waste incinerations and byproducts, and things that we care about, right? We've introduced things like flame retardants into our daily life, which we thought was an advance, but they're having this profound impact. And most recently, ocean acidification as one, which is related to climate change, right, from the formation of carbonic acid in the ocean, right? But we think about ocean acidification and we recognize the massive impact on the coral structures and shell calcification and the commercial fisheries impacts. These are profound impacts across the globe. You can advance, you'll see that there are a number of different groups that think about how to evaluate the status of the planet's health. One of them is the Stockholm Resilience Center has highlighted the planetary boundaries. And in a very recent paper at the end of 2025, they highlighted that we just passed yet another planetary boundary, that's the ocean acidification. So for those just very briefly to look at this graphic, the center is where things are healthy and in balance and provide a structure that is healthy for humans to survive in the environment, to maintain its resilient structure. But as in each of the different sectors or pies, slices, there are increasingly adverse effects. And so you'll see some of them are getting worse. Novel entities are the contaminants, the persistent contaminants, for example. And in 7 now of those planetary boundaries, we've now exceeded safe thresholds for human survival, with ocean acidification just exceeding that in this past measures. Okay, if we can advance, we'll see here that we've spent some time thinking about what do we need to do to teach about planetary health. And so we've developed a set of learning objectives to provide the critical foundational knowledge that students need about planetary health. That's really foundational. And it builds on and partners with the CUGH Global Health Learning Objectives, right? The critical foundation that we need about global health. These are both available. That QR code is listed right here. So if you want to get right to the paper and see those spelled out, what the learning objectives are, you can easily get to them there. And we advance very briefly. The learning objectives are important. Go ahead and advance as one resource that you can use. Those are helpful for what you need to ensure that a student understands what's going on in a particular class about those particular things, about global health, about planetary health. There are resources through the One Health model that can help advance, and the Planetary Health Alliance has released the Planetary Health Educational Framework, which provides a lot of additional tools that you could access as well directly through the Planetary Health Alliance website. So those are other resources that you might be able to access and use as well as you're thinking about planetary. GECKO is the Global Health Educators Community, is a group of educators that are interested in simply talking about and thinking about how to advance all of these opportunities. You're welcome to join at this particular link, cugh.org/educators. And if you're interested in chatting, we'll have tomorrow's virtual Teachers Lounge will be at 3 p.m. Eastern Time, 12 p.m. Pacific Time. And it's an hour where folks can just sit and talk about things. So we're hoping to follow up on today's conversation in that venue. Okay, learning objectives work for individual courses. Competencies are what we use to advance entire curricula. What do we need for undergraduate global health majors or minors, or global health master's degrees, whether it's a master's in public health, a master's in global health, or at the medical school level. So the competencies are a really essential component. And I'm going to pass the conversation baton to Dele, who will have a chance to discuss the global health competencies and how they might be informed by this new definition on global health. Dele?
Thank you very much, Carol, and thanks to Jessica and Kathryn for setting the tone for this conversation. I'm also really thrilled that we have people from pretty much all corners of the world in the audience. And my co-chair for the CUGH Competency Subcommittee, Dr. Chowdhury, is online with us, and she's, I think, logged in from Bangladesh. So all time zones are represented as well. I put a link to the CUGH Competencies Toolkit in the chat for those who want to access it. But there are many, many reasons that we have to think about this new definition of global health and its implication for training and empowering a competent workforce. On the next slide, I have some questions that I wanted to guide the discussion from this point of view of practice. Even though conceptually global health can be defined, but it's actually a physical thing as well, because it means people, it means money, it means places. And so when we say global health, it can collapse, meaning those people, places, funding can disappear. from the landscape of academics and professionals. If that happens, what are the implications for me, for you, for our families, neighbors, city, state, country, and our world? Does it matter if a particular country decides not to participate in what we mean by global health as we define it? Does it matter that a wealthy country can withdraw funds and talent from participation in the organization that we entrust to do global health, the World Health Organization? And so, thinking about all these questions as I prepared for today's conversation allowed me to really think through what training and empowerment means for people and the planet. It, it's a way that we establish a shared framework for addressing borderless health challenges, ensuring equity for vulnerable populations, and guiding funding, research, and policy. All of these are embedded in the new updated definition of global health. How we transform that definition into education and practice is important. And on the next slide, I share some of the things we've done in the CUGH competency subcommittee to update the domains in the toolkit. It's always going to be a work in progress. Many people have contributed to these domains since the inception of the toolkit. We're currently in the third edition, and I'm thrilled to say that we kind of anticipated the definition by establishing a domain in planetary health, for example. We kept the equity frame by thinking around decolonizing global health. That's the domain number 14 on this list. But a lot of what we call policies, priorities are also included in domain number 12, which is how we institutionalize global health and sustainable development. What's not explicitly clear in all these domains is how we integrate all of that into the professional practice. So as we think about the next edition of the toolkit, we will certainly be looking very closely at this new definition at the 5Ps and how we can strengthen some of the domains, maybe consolidate some, or add one. On the next slide, I have an example. So in the abstract of the new article, an updated definition of global health, there was a statement there saying the definition makes One Health and sustainability more visible. And I have to say that I didn't see explicit references to what has been traditionally meant by One Health in that article. I think the spirit is there. As Jessica said in introducing me, I spent the last 5 to 6 years working with an international team of experts in the US and across the world, building an academy for One Health. Even though USAID has collapsed, this academy has not collapsed. Thankfully, we have champions in Africa who established the Africa One Health University Network or Afro-HUNA Academy, and also in Southeast Asia that established the Southeast Asia One Health Workforce Academies. I think it's important to know that even though One Health brings in veterinary health professionals, environmental health professionals, and practitioners, in the new definition of One Health, it's implicit that all of these are included when we think about not just pandemics and plastics. They're all part of what we need to worry about in terms of global health and to collaborate across all of these sectors. So I encourage you to continue to visit these One Health academies as they think about this new definition and also adjust what they do. The other way we need to think about the new definition of global health is to think about the organizations that we've entrusted to carry out the functions and the practices. One of these is, of course, the World Health Organization. And in the last 3 or 4 years, I've worked with the Health Workforce Office to establish competencies and outcomes for essential public health functions. We've met several times. The last meeting of the steering committee was in Amman, Jordan, in 2024, and we had the opportunity to think about what global health means in areas of conflict and how we deliver those promises across the 5 Ps. We are having the next steering committee meeting in Geneva in March of this year. And I have to say that because the United States is now pulled out of WHO, there's a lot of pressure to reorganize. And this Health Workforce Office has merged uh, in the last month or so with the WHO Academy in Lyon. In a way, this is a silver lining because it means delivering these competencies, making sure that countries adopt them with the lens of this new definition of global health and the 5 Ps, and delivering essential functions will be more powerful, and the workforce will be trained according to new understandings of what global health actually means. Some of the domains in the competencies framework are here embedded in the slide, and many of them have to do with practice. So I applaud the authors of the new definition of global health of thinking ahead about how we can fill in the gaps that remain across our institutions and organizations that really do the work of global health. And now I will pass it on to John to tell us a little bit more. Thank you.
Oh, thank you so much, Professor Ogunseyitan, and all the excellent panelists that have spoken before me. And thank you, CFHI, for organizing this. I think there is a lot for all of us to learn, and we hope that we can have an excellent conversation. If you could kindly go to the next slide, please. So I think the previous speakers have expanded a lot on the definition, why it's necessary. My job is to think about it from a classroom perspective. So what do we do with all of these beautiful updates and thoughts on what we want to do with global health? First is, are we on the verge of a curriculum update? Are there things that we need to start considering to say, okay, this is a new definition that has updated what we previously used that primarily focused on equity. Now we are talking a bit more about integrating policy issues. Not that we didn't talk about it before, but this definition brings it out to the fore. Are there issues around policy that we need to bring to the front and the center of our discussions in classrooms? How do we expand our assigned readings? Is it time to do a critical review of some of the readings we have on our syllabus and on our curriculum for the introduction to global health classes and the higher level global health classes as we progress through our global health studies, and of course, discussion forums like this bring to the fore the necessary opportunities for us to actually deconstruct this definition and bring it back together, as we look through the definitions, how it's useful and what we can benefit from it and how we can expand it and how we can make it work for us. Those are things that I think are very important for us to take note of. If you kindly go to the next slide, please. Just a few things that occurred to me as I was reading through the paper again and the definition is, like Professor Gunshe talked about, and my other colleagues, if a rich nation pulls out of the WHO, what do we do? You know, especially bearing in mind that this rich nation funds a lot of the work that happens in the global health space. How do we begin to address issues around multilateralism that is breaking down, and our country that is now focused more on bilateral relationships? We've had, as an African, we've had the US sign bilateral contracts and treaties with Nigeria, with Kenya, you know, countries that have come forward to sign these agreements on getting funding for their PEPFAR programs. But we have a country like South Africa where they have the highest number of people living with HIV, but they don't have these bilateral agreements, and people are dying from not getting drugs to HIV. What do we do in those kind of instances? And knowing that the WHO is already handicapped, you know, so how do we begin to teach students about the role that policy plays, especially when policy is placed over evidence? What can we do? How do we begin to think about that? I think for students, that is a critical piece that we need to bring to the front and center of our discussions, so that students have this idea. And yes, it's good to believe in science. That is what we want to teach our students, but also for them to understand that science alone is never enough. I think if we didn't know anything before, that is what we are learning now, that science alone is never enough. The politics, the policies, the regulations, those play critical roles in terms of what happens in the real life, in the real world. Then, of course, issues around migration are also very important. How countries address their health workforce and what they choose to do, the incentives they put in place, helps to decide who stays and who goes, both for healthcare workers and the general population. I mean, we know of multiple countries where there are crises at this time and how migration has affected those populations. And we also, something that I've been thinking about lately is, how do we make sure that our students are not just focused on the migrant populations when they leave and where they go, but that transition period between when they are leaving and when they are getting to where they are going? That has significant impact, whether they travel by road, by land, by air, by water, you know, whatever it is. Those are things that we need to also begin to bring to the fore in our discussions. And of course, as I'm an advocate of locally developed infrastructure. I've as someone that grew up in Africa and worked there for a long time. How do we begin to develop this local infrastructure in places where they don't have as much resources? In Nigeria, for example, one of the things we've done is developed what we call the ICON 3 Practice-Based Research Network and the Nigeria Implementation Science Alliance. And that's, for the past 10 years, without any external funding, has been doing its work, both for research, for teaching, for policy, for government engagement. That's an example. There are many examples across the world. How do we structure those things and help people learn locally while also benefiting from international agreements? Of course, things that happened in the past and that continues to determine what happens currently. When you look at structures for the International Monetary Fund, the World Bank, and all of that also play a critical role. And of course, country policies. No matter how much we speak in these settings, there are just some things that have not changed over time, right? So take, for example, in the Middle East, we know we have the kafala system. We know the challenges with those systems. Luckily, in Saudi Arabia, for example, they are making some changes, positive changes to the system, and we hope that that would translate. If you can kindly go to the next slide, please. Other areas of focus are the equity issues, we need to continue to bring that to the fore. I think the first definition, and this definition placed equity right and front and center. So that's a good thing. Of course, issues around climate change, expanding, the introduction to global health classes, for example, we've always had one module for environmental health. But I think with planetary health now, we can't have just one module. We need to start thinking, how do we expand that beyond just environmental health to one health and planetary health and integrate some of those competencies further? And of course, issues around globalization and pollution. In the news recently, I think 2 months ago, there was a paper published and talked about how some commercial agents were exploiting countries, low and middle income countries, and creating lead extraction factories in certain cities, right, where they're extracting lead and bringing it back and using it to make batteries here in the US. Those things have implication for the health of the population and the planet. I think Kathryn has talked about armed conflict and pandemics, so I'll just let that. All the other things that we need to consider in terms of power structures, how does that play? Global health diplomacy, global health security. Is bilateral approach, are they better than multilateral approaches? How do we balance all of that? Are things we need to consider. Next slide, please. So to wrap up, I think for me, maybe because I like to work in the field a lot, I always ask myself and ask my students that, yes, we can have these fancy discussions in the classroom and they are good for us to generate theory, to generate discussion. But we need to go to where the tire meets the road, right? And how do we apply all of this in the global health space? And I always ask my students to think about this from 3 very broad perspectives: the people, the politics, and the science. Anytime you are thinking about public health programs, global health programs, you cannot leave any of this out. And you can see that when the people and the politics intersect, you want to look at what is the culture, the tradition, the religion, the history of those people. Where politics interferes with science, how do we make sure that the science we generate, the evidence, is evidence-based and is cost-effective? How do we get funding for these programs? And of course, the science and the people, how do we generate new evidence and how do we make sure that this evidence is used appropriately? So those are some things I think I encourage the students to think a bit more critically about in the classroom. I think I'll stop here and hand over to Abraham, and hopefully we can come back for discussions. But these are things to just think about in terms of critique. When we say sustainability, what exactly do we mean? How do we balance program sustainability and environmental sustainability? As we expand the scope of the definition, how do we make sure that we are not stretching ourselves too thin, that then we are now ineffective in each of those different competencies? Those are things to think about. Thank you very much. Abraham, thank you.
So I'm coming at this as someone who has taught in our undergrad and our graduate program a number of different global health classes. And I also link students with international internships. And I've been really excited hearing what the other panelists have been saying and very grateful to CFHI for this opportunity to talk with you. Next slide. So many of the students at the University of Michigan who come into global health classes have already taken some other courses in sociology or in I guess, domestic public health. And I believe that this updated definition of global health is much more in alignment with some more recent advances in social epidemiology. So this is a diagram looking at fundamental causality, and many of the students that come into global health classes have an understanding of social determinants of health and why do things like racial inequities occur in modern day United States. I think that this line of thinking maps really well onto the people-planet axis of the updated definition, where there really is this focus on drivers of health and migration. Next slide. I also appreciate the linkage to policies. We have seen healthcare in the United States is very expensive, and this is something which is substantially different than other parts of the world. What do countries prioritize? How do we make decisions about health economics? That's a really important question for us to raise early on in our global health curriculum. And this is certainly something which links to the policies and practices to priorities axis in this updated definition. So I definitely want my own students to be able to conceptualize what is a priority in a country and how does that link to what we value. So one of my roles in the near future is to also kickstart the development of a new undergrad global health minor. And I was really pleased that planetary health focused so much in this updated definition. It does make you think, what are the courses that could be put as electives or potentially as requirements in this kind of minor? And what should we be focusing on in core classes? And this also makes us think if we are linking students with international internships as part of our programs, like what kind of internship would be eligible? And so I think those internships, which are a bit more environmental focused or focused on animal health or One Health, I definitely think that's something that we should prioritize in the future. And with that, I think we are pushing it out to the audience for any kind of questions that you might have for us.
Thank you, Dr. Wagner. Thank you all. That was amazing and so many incredible tidbits of information and perspective, which I really appreciated. So we'll open it to questions and comments. Use the Q&A function in your toolbar for Zoom. I have a question. When you look at priorities, there seems to be tension between a human rights approach versus an approach that prioritizes tertiary care or expensive care for just a few. So I guess distributive justice and how that plays in. Um, do you have any assignments or approaches with students to help emphasize the differences in how priorities shape human realities and thriving?
I can go quickly. There used to be an organization in Geneva that's linked to the World Health Organization, but not part of it. It was uh, supported by private funds, and its money. It's sort of key phrase was the 1090 equity problem, meaning that we spend, 10% of the money on diseases that affect 90% of the people. And 90% of the funds go to the diseases of the 10%. And I think the global burden of disease project kind of emerged out of this thinking. And so in the CUGH competencies toolkit, you know, one of the domains is the global burden of disease. How do you prioritize? So if you have a fair way of um, accounting for the burden of a disease on the population, you should prioritize the diseases that have the highest burden. And in many cases, that's what we aspire to do. I think countries move their funds in different ways, and internally, they make decisions about what should guide the distribution of the funds to affect the diseases. But if we have a global health framework and a definition and its implementation that we agree to, then we should diminish this inequity issue that you talked about. But that's a work in progress because, as we can see, even in the US, there are many different reasons, politically and economically, why we don't do what the data says. I'm sure others have
I'm sure all the other
insights
P's
on this.
that
Yeah.
you mentioned and the cultural norms.
Yeah.
We have a question from one of the attendees. Um, the question, I brought the slide up because it's related to this. It's a 5P models, but the diagram has 4 arms. Could you explain how the 5Ps and the 4 arms intersect or overlay?
Yeah, I can take that one. And I realize it's a bit awkward to have 4 domains and 5Ps. Partly, if I'm being fully transparent on that, it just looks cleaner to have a nice grid than to have 5 axes. But the underlying premise for that is that we wanted it to be that that base is the actions. And so policies are actions because they're shaping financing and implementation, they're shaping partnerships. And so policies and practices are so intertwined that to try to artificially separate out those functions felt more awkward than keeping them grouped together in the figure.
Okay, perfect. Thank you. And then Dr. Tesfaye Guebriet, who is one of our invited faculty for CFHI, mentioned that he was expecting to hear more things on armed conflict and its impact on transformative development and education, especially in East Africa, Middle East, and Ukraine, including Ukraine and Russia. Do you have any other comments on armed conflict and how it fits into the new definition, or how to emphasize the impacts in an educational environment?
I see lots of panelists looking at other panelists on the screen. So
I
I'll start that answer, which is to say that armed conflict is another one of the many examples in global health that overlaps with every part of the 5Ps. And we know that it very much affects the center of that model, which is health for all. So we can't achieve health for all when we have armed conflict. Armed conflict affects the people side very directly. It comes out of the planetary side if we think of planetary as being these global processes, as well as having environmental impacts. And it does require that priorities and practices and policies access to move into talking about peace and to moving toward active solutions. And so in my own teaching, there are lots of case studies that I do that I use to show how things are integrated throughout that model and how they link to global health. And wherever that conflict is happening in the world, that is something that can really be a valuable thing that we can use the 5Ps to explore.
Thank you for that. Another question. Oh, sorry. Was there something to
No,
add
I was gonna add
yeah.
quickly. I think
Yeah.
like Abraham, we at UC Irvine, and I see a lot of our students are online. We have a course, we have a minor in global health for undergraduates. We have an intention to make that system-wide. All 10 UC campuses should have something in global health for students. And one of the courses we have is called War and Public Health. And it's a course that we hope eventually will never be taught because we don't have wars anymore. But that is a, aspirational goal. But within that, there's a lot of the 5Ps, as Kathryn said, embedded in, preventing uh, wars is part of global health, making peace and negotiations and collaborations and partnerships. If we stop talking to one another, like we said, if a country withdraws from everything, it just creates a gap, an opportunity for conflict and war. So we cannot ignore when separation defines international agreements. We need to figure out a way to bring that into global health, that we also make peace as a way to advance population benefits in global health. Thank you.
Thank you. Another question coming from an audience member. To avoid only teaching the moment, how should our curricula change to also embrace a reimagining or rethinking in this area? Meaning that oftentimes people are struggling with being critical of the system as it is, as it was, without envisioning a future that would be better, or focusing on that. So how do we avoid teaching the moment? And I'll just throw that out there, any of you who have thoughts on it.
I'll take a first stab at this, Jess. One of the things that I think is most impactful is being able to take a comparative approach. And I think a lot of our curricula in major programs have a little bit more opportunity perhaps to do that than in minors or certificates, for example. But that comparative approach allows you to look at both high income countries and low income countries, for example, that have different approaches to healthcare systems, right? So looking at the middle income countries that have advanced to universal health care and have opportunities that can be learned from across the board in a way that we allow students to explore strengths from a variety of different locations. And I think that's an important approach to use that. The health issues then you can use those in the application of the ideas, but you get to see the breadth and range of ways that people are dealing with things, and it does not center high-income countries necessarily as being an end product that other countries should be aspiring to.
Mm-hmm.
Just to add to that, I think to be very honest, I think global health has been used as a tool for diplomacy and for power. So unfortunately, there is nothing we can do about that, at least at our level at this time. Politics is, I mean, as some people say, politics is a master science. And we need to, having understood that, the question then is, will there be a time when there will be equitable power sharing? If yes, then perhaps countries don't need to get loans and grants from other countries. That is the only time that countries can determine fully for themselves what they want to do with their health system without having been dictated to by someone else or by another multilateral or bilateral treaty. But knowing that is very unlikely that that will happen, the question then is, within the structures that we find ourselves now, what can we do? How do we prepare our students to make sure that they are ready to face the world when they get out of the academic system? You know, how do they prepare to make sure that they are ready to answer the difficult questions, to understand historical perspectives and how to deal with things going forward? We are hoping that we'll get better as a global population in understanding people, being tolerant, and making sure that everyone has what they need to live a happy life. But we'll just do our best within the structures and conscriptions that we have.
Any
Thank
other?
you.
Yeah. Yes, I think it's interesting. I'll just, I know I'm only supposed to be a moderator, but just a comment that kind of intertwines both these things. When teaching about the US, there are such huge differences right now between how the states are approaching health access, finance, quality control, and many of them are breaking down via political leanings. So I'm in Idaho. I also work in California. Probably couldn't be two more polar opposite states in terms of how they're approaching. They're trying to get rid of Medicaid, which ensures over 40 million people and is essential for people who are both working and disabled and children. And so I do think there's a great opportunity right now because politics is getting so intertwined with healthcare, finance, and delivery that you can actually do comparisons, not just of a nation, but of particular states in the US to help give students an understanding of what that is and even to think about where they want to live and how they want to speak with their feet in a variety of different ways. Great. Any other questions? I'm just looking. I had a question about kind of power and privilege imbalances in global health. I really appreciate all this work. I also continue to reflect on how the hegemonic assumptions we all have and how we know what we know. And I wonder if you have any thoughts on how we bring more indigenous and other ways of knowing around health and wellness and thriving into our academic spaces and into our definitions, and how we give greater voice to voices that aren't often wearing white coats or in lecture halls. I wonder if anyone has ideas around that.
I thank you for bringing that up. It's really important. And as we think about the fourth edition of the CUGH Competencies Toolkit, we've been soliciting for topics that should be featured. I think there is a missing component of global health, which is kind of indigenous knowledge and inclusiveness in systems of knowing. I don't quite know yet how we will capture that as a domain, but all over the world, there is so much we're leaving on the table about how communities have practiced healthcare and how we can learn across countries, across communities from those practices. I think it belongs in global health. I just need the experts, anthropologists, and others to help us in this particular domain.
Thank you for that. Well, we have to close, so food for thought and some challenges for all of us as we move forward together. Please join us for the upcoming CFHI events, including our practicum showcase. We all know that immersion in global context can change a person's heart, mind, and future career choices. And so this will showcase how CFHI is doing that for practicums, and an info session for undergraduates looking for global health internships. I want to thank all of our panelists. I want to thank Blair and Robin for their hard work supporting this webinar, and just encourage everyone to let the world change you, as CFHI always says. Take good care.
Thank you.
Thank you.